month is Arthritis Awareness Month and National Osteoporosis Awareness and Prevention Month. Sometimes called degenerative joint disease or wear and tear arthritis, osteoarthritis is the most common chronic condition of the joints. It occurs when the cartilage or cushion between joints breaks down, leading to pain, stiffness, and swelling. According to the Arthritis Foundation, by the year 2030, an estimated 67 million adults age 18 years and older will have doctor-diagnosed arthritis. 2/3 of those with arthritis will be women. Of concern is the fact that women, a group already at increased risk for osteoporosis, are 2 to 3 times more likely than men to have rheumatoid arthritis as well. We spoke with a specialist at the Center for Medical Imaging about the important role imaging plays in diagnosing arthritis.
Inflammatory arthritis is a different kind of arthritis, and it's different from the degenerative type in that what happens in the joints is inflammation. So inflammation is the reason why these patients have their symptoms. Probably the 3 most common types of inflammatory arthritis that we see in our community and in our clinical practice is rheumatoid arthritis, psoriatic arthritis, and erosive osteoarthritis. And it's an important arthritis in that the clinical course of these patients is often very rapidly progressive if left untreated, as compared to degenerative arthritis, which may sort of take a very long time over a period of years to become really disabling. A patient with inflammatory arthritis may become disabled and have significant deformity and disability rather quickly if untreated. MRI has evolved to play a potential role in helping to diagnose these patients. On the MRI, there are 3 main findings that we are able to detect in patients that have inflammatory arthritis. The first is synovitis. What is synovitis? Synovitis refers to an inflammation of the lining of the joint. All these joints, they're lined by a tissue that we call synovium. And what happens in patients with inflammatory arthritis is that there is an influx of inflammatory cells and inflammatory tissue that invades the synovial lining. And so on MRI, we can see evidence of that as manifest by thickening of the synovium or increased, what we call enhancement, which relates to their increased blood flow or of the synovium. And we can also detect increase in volume of synovial fluid, because the synovium normally produces minimal amounts of fluid. But in patients with an inflammatory arthritis, a greater volume of fluid is produced. So we are able to detect synovitis in patients with inflammatory arthritis. So this is long before any X-ray findings may be observed. And so that's sort of one of the key features that we look for. So synovial volume has prognostic information in patients with inflammatory arthritis. Some of these studies have suggested that patients who present having large volumes of synovial fluid, they tend to undergo bony erosions or bony destructions perhaps within a year from that. Additionally, patients who at baseline, that is at the time of initial diagnosis and presentation to imaging, have marked synovitis as revealed by marked thickening, those patients also tend to have erosions at an earlier stage and perhaps within a year. And so the implication is that MRI potentially may play a role in helping to stratify patients into those who are potentially may have more aggressive disease processes. And therefore that information may be useful to the clinician to try and decide what kind of therapies to institute.
For more information on the board-certified radiologists at the Center for Medical Imaging, or to find out more about their numerous imaging procedures, please click the Arthritis Awareness story link icon on our homepage at yourhometownhealth.com.